Hi everyone, thanks for watching our presentation. My name is Shaylee Powell and my other team members are Anastasia and Bethany. Today we'd like to tell you a little bit about what we've been working on this summer, about homelessness, injuries, and public health in North Carolina. But firstly, we'd just like to thank our project leads Mike Fliss and Mary Beth Cox, as well as our wonderful project manager, Franco Amigo, for really guiding us through this project this summer. In 2024, the Department of Housing and Urban Development conducted a point-in-time count, which counted about 770,000 people in the USA experiencing homelessness. This number is large, but it is an undercount. It doesn't account for people who maybe couch surf, people who were displaced for a couple weeks or a couple months, people who maybe were experiencing homelessness for 5 years but then just received housing. So this number is not an accurate representation of how many people in the U.S. are experiencing homelessness at one time. It is known that people experiencing homelessness, or PEH, face a heightened risk of disease and injury through multiple reports and multiple observations. But despite this, and despite the undercount in the population of PEH in the U.S., there's no national reporting system for the health and the count of people experiencing homelessness in the USA. This leads different counties and different states to conduct their own methods, leading to completely different methods across the country, which effectively hurts policy and eventual health outcomes for people experiencing homelessness. Our goal this summer was to analyze PEH mortality data in North Carolina, looking for trends, creating visualizations, things like that. We wanted to conduct a literature review of mortality reports across the U.S. and compare them to North Carolina's. And finally, we wanted to prepare a research agenda and suggestions for a future North Carolina mortality report. So over the summer, we've been researching the topic of people experiencing homelessness and specifically how they are more susceptible to disease. In addition, we've been doing a sort of meta-analysis where we've been looking at available mortality reports from other counties and other states, seeing how they conduct their research, and comparing it to North Carolina. In order to compare it to North Carolina, we've been doing data analysis on North Carolina's mortality data. We've created data visualizations and analyzed for trends, which we'll talk about later, using RStudio.
For the results section, after reading all of the mortality reports, we saw a lot of variance in terms of what sections and variables were included. This makes sense because there's no national reporting system, so each report is going to vary a little bit. Most reports were published by a medical examiner office or a county-specific homeless coalition. The variables that were the most common between all the reports were time of death, manner of death, location of death, and demographics, so like age and sex. North Carolina's data was pretty similar to all the other reports that we read. There were a couple of differences in the manner of death and the race distribution. So manner of death is divided into accidental deaths and natural deaths. And North Carolina found that natural deaths was the highest cause of death, whereas a lot of the other reports saw accidental deaths as being higher. North Carolina also has a higher African American decedent percentage and a lower Hispanic population decedent percentage when compared to some of the other reports. We have two graphs on our poster. Both of them were made by our team in RStudio. The first graph shows the difference in age of death when looking at people experiencing homelessness versus the general population, and you can see that that difference is about 20 years, which is pretty significant. And the second graph is a comparison of overdose deaths between people experiencing homelessness and general population, and you can see that people experiencing homelessness in North Carolina are about 10 times more likely to die from an overdose than the general population.
Our goal for our abridged mortality draft is to serve as a more standardized approach for mortality reports on PEH that other counties and states can follow. Additionally, our research agenda outlines important research questions on PEH that can be incorporated into future projects on topics such as clinical care, sanitation and hygiene, and natural disasters. However, while exploring the data, we found consistent limitations that highlight the need for improved data integration and comprehensive population tracking to create a more accurate mortality report.
We hope this presentation was informative, and thank you so much for listening.